Welcome to the Radiology Vault, an open repository for radiology educational content designed for learners and medical professionals. Presented by the Michigan Medicine Department of Radiology.
This presentation summarizes the normal anatomic imaging landmarks of the paranasal sinuses relevant to functional endoscopic sinus surgery. The central midline vertical bony projection is the crista galli. The falx cerebri attaches to this structure. On either side of the crista galli are the olfactory grooves, which house the olfactory nerves and bulbs. The cribriform plates separate the olfactory grooves from the nasal cavity and is home for the olfactory nerves. The lamina pepraceae are thin plates of bone which separate the orbits from the ethmoid sinuses. The unsinite process is a bony projection from the ethmoid bone, which is an important surgical landmark to define the hiatus seminolaris. The infundibulum is the opening of the maxillary sinus into the middle meatus. The inferior and middle terminates project in the nasal cavities and play an important role in regulating, conditioning, and filtering the air breathed in and out of the nares. The fovea ethmoidalis is the medial extension of the orbital plate and forms the superior and lateral aspect of the roof of the ethmoid sinuses. The infraorbital canal is in the roof of the maxillary sinus and transmits the infraorbital nerve, branch of the maxillary division of the trigeminal nerve, together with the infraorbital artery and vein. This coronal section shows the attachment of the middle terminates on either side of the cribriform plates. The nasolacrimal ducts are demonstrated along with the frontonasal ducts. Evidence of bilateral inferior terminectomies is noted in this section. This parasagittal reconstruction shows from the anterior to the posterior extent the frontal sinus and the frontoethmoidal recess. The clothes hanger shaped middle terminate is visualized together with the vertically oriented bony attachment to the anterior clear fossa floor. This attachment is called the basal lamella. All anterior air cells anterior to the basal lamella are termed the anterior ethmoid air cells, and those posterior to the lamella are termed the posterior ethmoid air cells. The anteriormost ethmoid air cells closest to the frontal recess are called agar nasi air cells. Next, we'll focus our attention on the structures posterior to the basal lamella, which include the posterior ethmoid sinus and the sphenoid sinus. The posterior ethmoid sinus and the sphenoid sinus are separated by a space which is termed as the sphenoethmoidal recess. The ostium of the sphenoid sinus drains into the sphenoethmoidal recess. The ostia are located high along the anterior wall of the sphenoid sinus. The other two important structures which are lateral to the ethmoid sinus in the coronal plane are the superior and inferior orbital fissures. In this coronal section, we also see the structure named as the planus sphenorale, which is the flattened surface of the bone of the anterior clear fossa, which will bridge the posterior ethmoid sinuses and the sphenoid sinus. The next section shows important surgical landmarks in relation to the sphenoid sinus. These are the anterior clinoid processes, one on each side with the optic canal and foramina medial to them. The thin plate of bone along the lateral wall of the sphenoid sinus on the left side demarcates the optocarotid recess, with the carotid siphon immediately lateral to the bone and the optic canal and nerve superior to it. Surgeons are acutely aware of the location of the recess, the thickness of the bone, and the intersphenoid septum in the sinuses, all of which are important landmarks. In this section, an important isolated air cell is noted adjacent to the recess, which is termed as the Onodi cell. The Onodi cells are believed to be the extension of the posteriormost ethmoid sinuses, which occupy the superior and lateral aspect of the sphenoid sinus, and then can exist and extend into the anterior clinoid processes. If infected, the endoscopist may be misled to believe that they are in the ethmoid sinus and may accidentally injure the optic nerves. To summarize, the essential underlying principle of approach to studying the paranasal sinus imaging anatomy is to recognize the three inherent narrowing of passages which drains the paranasal sinuses. The first is the frontal recess, which drains the frontal sinus into the narrow anterior portion of the hiatus seminalis. The next is the anterior ethmoid air cell and maxillary sinus drainage into the hiatus seminalis via their inherently narrow ostia. The third narrow area is the sphenoethmoidal recess, which is the final common pathway of drainage of the posterior ethmoid air cells and the sphenoid sinuses. Thank you for your attention.